Um, and so we're just waiting, and we're excited about you guys being here. Again, my name is Tanisha Barnes. I serve for the Arkansas Opioid Recovery Partnership. I am the deputy director for that as well. Director Kirk Lane could not be here. Unfortunately, he is in surgery. Well, he's supposed to be. He's calling me right now. I'm not sure why, but he's headed to surgery, but he's doing great. Is perfectly in and out. He's fine. But I also just want to say thank you guys for jumping on here. We're going to give it one more minute. I see someone else is trying to connect. I'll jump on mute if anybody else want to jump in. I think Liam was going to say something.
Yeah, and I was going to say, for those of you who do not know me, I know a lot of you, but for those of you who don't, my name is Lynn Hawkins. I serve as the Chief Operations Officer for the Arkansas Rural Health Partnership, and I have had the great honor and pleasure of working with Kirk and Tanisha and Joy in developing some of this, and with Cammie Rice and Carter Holder that you're going to meet shortly, with the Christopher Wolf Foundation or Alliance. And I mean, this is just a great opportunity. I thank you all. For some of you, I know it's spring break in Arkansas. So some of you, I have no idea where everyone's joining from. As you can tell, I'm joining from my car, but I'm here. And I am just really excited about this opportunity, and hope that some of you really take this chance to apply for this funding and to address this issue that we have going on in our state. For some of you, I have worked with you on your community health needs assessments. And what Cammie is going to be talking about later is something that we have seen come up in these assessments. For those that I've been involved in, we have seen this topic come up over and over and over again. So I just want to thank you all. And anyway, I'll stick around if there's any questions at the end that I need to do. I will be happy to participate.
Thanks, Lynn. Thank you so much for that, guys. I see people are all on here. We're going to kick this thing off. It is officially 12:07. We're not going to hold you. We know that you're very busy. And we're going to start the presentation. Carter, you ready?
Give me 1 second to get that pulled up. Can everyone see my screen?
Yes.
Fantastic.
So, hi, everybody. As I stated before, my name is Tanisha Barnes. I serve as the Deputy Director for the Arkansas Opioid Recovery Partnership. This funding was given to the Arkansas cities and counties when we sued Big Pharma for $216 million. The Arkansas Municipal League and the Association of Counties came together to create what you call ARORP, which is the Arkansas Recovery Partnership, on November the 4th of 2022. Our purpose for this funding is to distribute opioid settlement dollars to organizations who intend to abate the opioid epidemic. Next slide. So with that, as I stated, that's me. I know you don't see me on camera because I'm at this beautiful park, but that is me there. And that's, he likes to call himself over there, that is Director Kirk Lane. He likes to call himself the eye candy, but we all know that who is the eye candy. But we're going to move that on. Next slide. So what we have here is our ARORP leadership. This is our team. This is when they came together, the cities and the counties. As you can see there, Chris Vallon is the executive director for the counties, and Mark Hayes is the executive director for the municipal league. So they came together and formed us. Director Lane, and I will be remiss if I did not speak on Miss Joy Spence, our data research manager. She'll be speaking later, but she's an amazing part of our team. She does all the data research parts. If you have anything to do with the data, that is us. Anything dealing with the budget will be Tanisha. Our program, and mostly out speaking, talk about our program, will be our Director Lane. Go to the next slide, please. And I know I'm running through this a little quickly, but I'm telling you the reasons why. So with this, how this funding came to be, we had sued Big Pharma. We got the Municipal League and the City of Counties came together. They put their money together, formed ARORP, formed the team with Kirk and I, But they said we decided that we couldn't make all these decisions for $216 million. We needed an advisory board. So what we did is we went out and picked these people that you see here. When I tell you we picked a great board, we picked an amazing board. This board here is not your yes board. Sometimes I have nightmares about this board because this board makes me work. Also makes Joy and Director Lane myself work. They have to be anonymous. I mean, everybody has to say that they're in agreement with the decision that we have made. Not one can say no. If it says no, it falls, and we have to start back. So this board here, we have they have education in grant writing, statistics. We even have a youth on our board, which is there in the red hat. We have doctors, we have lawyers, we have chiefs of police, we have city councilmen, we have the two lawyers, as you see on there, Colin Jurgensen and John Wickelson, are the two that was fighting to get the funding. They actually sued Big Pharma, so we actually have them on our board. We also have superintendents, we have board members, we have grant writers. I can just tell you this is a very diverse board. Next slide. So with that, how we're able to get here, they formed, once we got our funding, the lawyers and also myself and Kirk Lane decided that we needed something called Exhibit E. We needed almost like a Bible to tell us how we can spend this funding. Now, you can go on our website and see that, but this is the document here that is also on our actual website, which is the Arkansas Opioid Recovery Partnership website. And you can see that 14-page document that tells us how we're able to spend the funding. Doesn't mean that we have to spend the funding that's in there, but this gives us a great outline of how we can actually spend that funding. Next slide. So you say, Tanisha, you told me about Exhibit E, you told me about your board members. How do we get this process started? The process starts with you guys. You have noticed, and we have noticed an unmet need in our communities. And I will say, when I say we, I'm going to say Miss Cammie and Miss Lynn. They brought this beautiful project to us, and they decided, hey guys, we got an unmet need in our communities across Arkansas that we need to talk about the rural hospitals. How can we best help? And the plan was, we got together, we got a plan, we were passionate about it. When I say these ladies were passionate, they were very passionate. We have been talking for months to try to make sure that this come to fruition. We have taken the steps to put it together because we're all here on this call. And so with that, I am going to turn it over to Cammie Rice. She is the founder of this program, and she is going to tell you how this comes about. I'm going to throw it to Miss Cammie.
Thank you, Tanisha. Thank you. I'd like to say, we're based out of Atlanta, Georgia. However, I will say I salute Arkansas. I want you to know that your state is leading the country in this effort to fight the opioid epidemic. I'm not just saying that. You're leading the country. Many states have done zero actions with the money they've been allocated. So hats off to the team. Seriously, I mean that. And Carter, if you could pull up my slides. So our organization is CWC. We founded in 2018. And the reason that we're here today is because of this beautiful boy right here. This is my son. And he started in the hospital with a health crisis. And then we went home with 90 Oxycontins. And I actually followed exactly what I was told to do and gave them to him every 4 hours. And it totally hijacked his brain, and he fought it for 14 years. But the issue is many times addiction, substance misuse starts with a health crisis, starts with a prescription. So, I'm sure most of you know the statistics and how bad the opioid epidemic is tragic and hitting our country. Nearly 80% of heroin users start with an opioid prescription. Drug overdoses are leading cause of death. I'm not going to read off all the stats. I think we all know what kind of problem that we have here in our country today. And so when we looked at it, I went out when I started CWC, instead of going on the angry route, I went on, how can I take this pain and turn it into purpose? And I looked at what Christopher did not have as a hospital patient, what I did not have as a caretaker. And I talked to over 150 medical professionals, deans of medical schools, deans of nursing schools, psychiatrists, addiction specialists. And we felt like there was a missing person from the healthcare team, and that's called a life care specialist. Next slide. So if you look at the life care specialist, again, this was based on what I felt like we didn't have in the hospital. Somebody, and it's not that we didn't want to have it, right? It's just nurses having the time, having somebody to explain to me the dangers of the opioids that my son was given, the importance of tapering off those opioids, talking about Narcan. And then there's the mental side of being in a hospital, right? The behavioral pain management. When you're in the hospital, you have anxiety, stress, depression, PTSD. Maybe you might have all four of those things. So having somebody that has trauma skills and techniques to help you to deal with those stresses. And then there's the care coordination, preparing you to have conversations with your doctors. And honestly, the silver lining is we didn't realize how we were going to uncover so many other comorbidities, understanding that a patient has maybe home insecurity, food insecurity, domestic violence, so that we can provide other resources so that that patient does not fall through the cracks. Next slide. So what we did, we partnered with many organizations, right? We don't have the answers to everything. And so we knew it was really important to partner. And we partnered with Mercer School of Medicine to get our training curriculum. We have an online training curriculum. It's all module based. Everything that you see on the right-hand side, it is an accredited certification from Mercer University. And that piece of it that you see, all those items and all those modules on the side, that is all done online. And then we teach techniques through Zoom. And then we also have in-person hospital floor training as well. Now we talk about what is qualifications for a life care specialist. We're not requiring a college degree. And the reason why we believe that we have the education, they do have to become certified and they do have to pass the quizzes throughout the tests to become a life care specialist, but we feel that those skills can be taught. And really what we're most importantly looking for in a candidate are things that you're born with: empathy, compassion, non-judgmental, things that you can't really get in a piece of paper, but you do have to go through the certification. Mercer School of Medicine has created this pin that the healthcare worker, once certified, they receive a pin and an actual certification from Mercer University School of Medicine. Next slide. This is what we call the CWC healing wheel. We're always looking at different things to add to the toolbox. Not everybody deals with pain the same way, and what might work for Lynn to help her with her pain, Joy might need something else. So the life care specialist basically has a toolbox of different things that they can utilize to help a patient manage their pain in a non-narcotic, non-pharmaceutical way. Honestly, many times it also is having a listening ear, really validating somebody's pain and having the time to spend with that patient that nurses just do not have, to talk to that patient and make them feel more comfortable. We're also certified. Our instructors are certified with the Trauma Resource Institute, and we will teach the life care specialists those techniques to deal with the mental behavioral skills. Next slide. We've been doing clinical trials at Grady Memorial Hospital. Grady is one of the top trauma hospitals in the United States. Many people say if you can be successful at Grady, you can be successful anywhere. I'll be honest with you, many times it's like a war zone. And what we found out from our initial studies, that 70% of the participants didn't even know they were taking opioid medication. I'll give you an example. A man said, "Oh my gosh, my wife is in recovery. I had no idea I was taking an opioid," and going home with a prescription bottle of opioids. So it's educating is such a key piece of what we do at the patient bedside. Next slide. I want to take a second for you to listen. This is Dr. Mara Shanker. She is the chief of orthopedics at Grady, and she's also CWC's. She volunteers all of her time to be the chief medical officer for CWC. And I think it's good to hear from a physician's standpoint about the position. And it's just a 2-minute little talk. If you could have that play, please, Carter. Give us a thumbs up that you can hear the video when she. Sorry, hold please.
My name is Dr. Mara Shanker. I am the Chief of Orthopedics at Grady Memorial Hospital and the Chief Medical Officer of the Christopher Wolf Crusade. So why do we need life care specialists in our hospitals? At Grady Memorial Hospital, we are one of the top 2 busiest orthopedic trauma departments in the United States. We see a lot of patients who have tremendous injuries, a lot of pain, a lot of underlying medical and social comorbidities that contribute to a lot of pain. And when we're the physicians in these busy hospitals, we don't have a lot of time to be able to really understand a lot of the underlying issues that our patients have surrounding their pain and their perceptions of their pain. And since we started the Life Care Specialist program at Grady several years ago, we've had a lot of patients come through who just need someone to talk to. They need somebody to understand what their pain experience is like, and they need somebody to be able to give them a very personalized way of being able to get through their pain. And so one of the other things that the life care specialists can help our patients with is a lot of the mental skill set to help them deal with the anxiety surrounding their pain. And so that's something that as a physician in a very busy office where I'm seeing sometimes upwards of 60 patients in our clinic in a relatively short period of time, we can't really sit down and help them with their mental wellness skills to help them cope with a lot of their anxiety that's surrounding their post-traumatic stress that they experienced from the trauma that they had that led to their injury, and that really is a ongoing spiral related to the anxiety associated with their pain. Just having an ear to listen to them and to understand that and then provide them with that skill set of mental wellness techniques is extraordinarily helpful. Our experience with the life care specialist has been really remarkable. They sit down with our patients, they talk to them about their pain, they educate them on the risks of opioids, how to safely dispose of medications, how to use life-saving Narcan in the event of an overdose, and they really help them use non-pharmacologic or non-medication versions of pain control. So that varies very much depending on who the patient is and what their preferred method of what we call behavioral-based pain interventions is.
Next slide. I think, an important piece to this is the nurses' feedback. So while we're providing amazing services to the patients, we really have to look at the respite that we're giving to the healthcare staff. Nurses saying that the only thing I have in my arsenal is an opioid. So if I have a patient that's pressing that pain button, the only thing I have to give them is an opioid, or maybe if I'm lucky, a heating pad. And now they call the life care specialist to come in, and we come in and spend time with that patient. So I think we've been able to bring tremendous respite to nurses as well. And that's what's key, is formulating that relationship with the nursing staff as well. Next slide. This is just to give you just a tiny bit of background. Now at Grady, we're in orthopedic trauma, we're in palliative care, we're in sickle cell, we're in oncology. We're doing many clinical trials with the NFL on sports medicine, rural programs, and we're launching in 6 Georgia rural hospitals and selecting through ARORP 3 rural hospitals in Arkansas. Next slide. So we look at this, this is a very simple graphic, but just to understand, we really try to take on, while the life care specialist is a hospital employee, and we highly recommend that the life care specialist has reports into nursing, and that you would identify champions in the hospital. It's so important to have champions when you're talking about launching a new program in a hospital. That's been the magic to us having the success that we've had, is by having those champions. But just to know that CWC provides ongoing support. We do all the training, and then we also do management and support of the LCS on a weekly basis. We get on team calls. We collaborate, all LCSs, on a weekly call. So we share stories and we learn from each other's experiences, and they do a weekly report. And so we're trying to take away all the heavy lifting from a managerial standpoint, but they do need a key contact in the hospital to navigate how to work within the hospital, how to get access to certain things in the hospital. And that's where we would lean on. But this is really, truly about a partnership. It's about us all being partners together to save lives. That's the ultimate secret sauce to this being a successful program. It's just really looking at this as a true partnership. Side. And now I just, we're going to go to Joy, and then we'll open it up. I know it's like taking a drink out of a fire hydrant because we just gave you a lot of information, but Joy's going to go into the specifics, and then I'd like to open it up. All of us would like to open it up for Q&A. And I just, again, want to thank Lynn, because, Lynn, Joy, and Tanisha, we would not be here if it wasn't for you guys all helping us work together to have this day happen. So it's an exciting day for all of us. Thank you.
Thanks so much, Cami. All right, so we're going to go ahead and talk about the actual application process. The way that all of our applications start is if you go to our website, www.arorp.org, you'll see that green button on the right-hand corner, which is funding opportunities. If you hover over that button, there will be a couple of different options you can go to. You can go directly to the application, or you can go to a section that is help applying. And that'll have different information about the projects and different forms you'll need for the actual application. Next slide. So this is what the actual application page is going to look like, except as you'll see here, we have our current 4 applications. Starting on Monday, March 25th, the life care specialist application will be up. So you'll go to our application page and just click right on into apply now. And if you want to just be learning more about the application, there'll be a link to learn more. Feel free to go ahead, you're good, Carter. Feel free to go ahead and click into the application, put your email in, and just look around. It won't actually submit until you press that submit button. So this is just a note for successful application or successful applicants for the Arkansas Opioid Recovery Partnership money or funding. These are opioid settlement dollars. So every project has to have a clear opioid nexus, meaning that it is directly going, those dollars are going to projects that abate the opioid epidemic. So notably on the do this, not that portion, we require that you meet with mayors and county judges in your jurisdiction, explain what the project is, and there'll be a signature sheet specific to the project, which is up on our website, that you'll have them sign if they are comfortable and excited about the project. And the reason we do this is because our funding actually goes directly to the cities and the counties, and we want mayors and county judges to be aware of what you're doing, aware of where those dollars are going in your community, and on board to back you up and provide support if that project goes through. So on just some notable things, everything has to have a clear opioid nexus. And luckily, since this project, Cami and the team has done an amazing job of baking that opioid nexus into the project. So just make sure that your application is all ready to go before submitting, and I think you should be good to go. The last thing on that is do not submit without developing a clear sustainability plan. So you'll let us know what your sustainability plan is to keep this program going after the 2 years are over. So this is a 2-year project. And then next slide. Okay, so what is needed to apply? You will obviously fill out the application and submit. We'll also ask for a W-9 for your hospital or medical system. We will provide you with a sample budget. And to the right, you can see these are small numbers. And this may change just slightly before Monday when this is posted, but we'll provide you with a sample budget. There are areas where you can go down in the budget, but you wouldn't go up on any section. So for example, when we go into the LCS salary, if you have a lower starting salary or if you need to adjust anything, I think in a newer version, we have benefits in here. If your benefits package is lower than what we estimated, then you can lower it. You just couldn't raise it up with our funding. Then the signature page, so that will be available on the website and in the application. You'll print it out. It's specific to this project, so it'll say Life Care Specialist at the top. And the very last thing is just read the website. It sounds self-explanatory, but we really take pains to put the steps of the application out on the website. So read through and feel free to reach out to us if you have any questions. Next slide. So once your application is submitted, what's next? What is the funding process? Next slide. After the applications are submitted, they're going to be reviewed by Lynn with the Arkansas Rural Health Partnership and Cammie and team with the Christopher Wolf Crusade. So they will review the applications, see that everyone has everything that they need, and then pass it on to the ARORP team. Next slide. So the ARORP team will then review. We may be in touch if there are errors in your application. And then we're narrowing these projects down, making sure that they're absolutely perfect and ready to go before the board. And just to note, at any of these stages, there can be denials. And then next slide. Then another stage, it'll go before the ARORP advisory board. I'm gonna sneeze, one moment. Okay, I didn't have to sneeze. That was a lie.
Bless
Sorry
you.
about that. Thank you, because I said it. So it'll go forth to the ARORP advisory board. Next slide. And again, they may push it forward or, well, sorry, keep feeling I'm about to sneeze. My bad. I thought it was happening again. Actually, will you go back to the board side? My bad. Yes, so it'll go towards the advisory board. If they push that forward, it will go to, again, one more step, which is the Qualified Settlement Fund, the administrators of the Qualified Settlement Fund, who actually are lawyers who control that project. We have many lawyers in all of these stages along the way just to make sure that it is in compliance with our opioid settlement fund requirements. It'll go to the Qualified Settlement Fund, and if it passes through that final step, then you'll be issued a check. So we pay up front, so you'll receive a check with all of your dollars up front. And the requirements, if you have any questions about budget, that is our Deputy Director, Tanisha Barnes. She is amazing with budgets. So any questions about programming, send those her way. And to note for your budget, whatever you submit to us, we will, the reporting process or what that process looks like after funding, if you were to receive funding, is you would report to us quarterly for those 2 years. You would submit your annotated budget or budget with notes, specifying exactly what was spent in each line item. And you are not permitted to move money from line item to line item. So just make sure that you're really reviewing that budget on the front end. Next slide. Thank you. And then finally, so our director, Kirk Lane, and Deputy Director, Tanisha Barnes, have been really incredible and amazing in creating this app. So this is Revive AR. You can find this on the Apple Store or Google Play. And this is just for anyone to have in your hospitals. If you want promotional material, we would love to send it to you to have up. This app has instructions on how to administer naloxone in English, Spanish, and Marshallese. And then there are also recovery and treatment and prevention resources built into the app. So anyone can download and have in the palm of their hand a lot of important training and resources to access help in Arkansas. And that is it. So I'll kick it back over to Cammie And Tanisha, if you guys have, and Lynn, if you guys have any questions.
I would like to add on the training piece of it, and you'll see that in the sample budget. So the training, as I said, there's an online component, then we do some training on Zoom, but then we also have in the budget for the life care specialists, they will come to Atlanta. They will be trained at Grady. Grady is our training hub. We already have permission and partnership with Grady to bring in life care specialists. That's where they'll do the hospital clinical training on the floor in the hospital. And then we also have in that sample budget, our senior trainers will be coming to Arkansas, to your hospital, in your environment, and work with the LCS on the floor in your hospital as well. So our job is to make sure that you're successful and that the life care specialists have the right support. And then we have an ongoing hotline so that they can call a life care specialist if they get no circumstance, spit it out. Then we give support in that manner as well. But I would like to, yeah, definitely open it up if you have questions about the life care specialist role, about the application, everything that Joy presented, and Tanisha, anything that you would like to ask, now's the time to please, feel free to speak up. And
Tammy, this plan, I also wanted to just share with everyone that it'll be very critical, and I believe Mercer, the life care specialist will learn this, but whoever applies for this, it'll be very critical that the team there at the hospital take into the fold, into their team, this life care specialist. That's going to be a very, very critical stage there up front. So that, I know this will not necessarily, it could be, but it doesn't have to be, a nurse, a RN, LPN. It could be, a social, it could be anybody, because as Cami shared, there's not a college requirement for it, but they are going to receive very intense, very detailed training for their certification. And so we've kind of seen some of the things initially when you try to bring on a new team member, so I just wanted to make sure and make you all aware that that's going to be a very critical phase as well once this person is trained and they start this position.
Thank you, Lynn. Yep. Yeah, they do have exams throughout the modules on the certification. They do have to pass the tests before they are certified to go on. Any questions?
And real quick, I just posted in the chat. So the application opens on Monday, March 25th, and then it closes on April 19th, 2024.
So is there a list of deliverables for this grant? And my second question is, what is the requirement of the LCS as far as availability? Are they on 24/7, 40 hours a week?
No, they are not 24/7, but what we're allocating is 2 life care specialists per. So that way that there is, if someone's out sick or whatever, but typically they're on a, 40-hour work. And we'll do an assessment with the hospital to look at the needs and decide where in the hospital they're located. What we have been working on, just when Joy was talking about sustainability, one of the costs to a hospital, because we're always looking at the economic cost to a hospital. Once a patient is discharged, as you all know, if they have to go into the emergency department after that 30-day, in that 30-day window of being discharged, insurance doesn't cover it, and the hospital eats that cost. We found that if you can, help patients understand how to manage their pain, because we also do follow-up once they're discharged from the hospital. And if 2 patients don't come back to the ED in that 30-day window, you've paid for your life care specialist for a year. So we are working on getting economic value for the hospitals as well from that standpoint.
And go ahead.
Well, I was going to say, one of the questions as far as the deliverables, do we have anything that we can send them as they're preparing that, you all have already utilized with this program with the other hospitals, of what the expectations are when they begin their reporting process? Because I don't think we've seen anything out with that, but if that could be posted, something like that along Monday, whenever the application opens, that would be really, really good for all of the hospitals to have.
Yes, along with the application that's going up on Monday, Joy is also going to be doing, I'm not going to show you now because it's hard to see it, but it basically has CWC's commitment on one side of the paper, and then it has the hospital commitments laid out on the other side. So that'll be very helpful for you all to see. It was just a lot to put on a slide, but that will be included when the application goes up on Monday, on the 25th. But in regards to AORP and the deliverables for AORP, Joy, I won't want to reiterate, but what you said, they need to do quarterly reporting with budget.
Right.
The
So the
budget.
most important thing will be through the Christopher Wolf Crusade, whatever y'all's expectations are. And then for AORP side, you'll just submit a quarterly budget to us showing your spend to date and details about where you spend every dollar. And then we will issue quarterly milestones for you, which are really basic. They'll be based off of the expectations created by the Christopher Wolf Crusade. And it'll just be things like hiring the life care specialist, ensuring that the program is continuing. So most of the management will be through the Christopher Wolf Crusade and Arkansas Rural Health Partnership.
And we have on that sample estimates, because you as the hospital, you know how much you pay for a laptop and how much you do for employee benefits and things like that. So it clearly says estimated, and then what's set in stone, like the training curriculum and that type of thing. It's identified on that sample budget.
Any other questions, or are all the questions going to come after the application's released Monday?
Hi, Lynn. I have a question. So I work for Conway Regional Health System, and we actually have 2 different rural hospitals in 2 different counties. Can we submit more than one application, one for each hospital?
I would say that's fine. I mean, they, there's always the chance that one may get funded, one may not get funded. Now, unless there's any other, rules or anything like that from Tanisha and Joy from the AR. But yes, I would say a system that has rural hospitals could put in 2 applications. But like I said, we just have to keep in mind that they're only going to fund 3 of them. And good to see you, Megan.
Any questions about the actual life care specialist role? Any questions about that? Y'all are quiet.
I told you it's Friday of spring break in Arkansas.
I know, right?
Hi guys, this is Tanisha again, and I just want to say we will have all those documents. I know you guys are going to wait till the application goes up and the phones are going to get to ringing, but we will have, please take advantage of the AARP website. We will have the Learn More, we have FAQs, we'll have everything up there. Once that application goes up, you hit Learn More, we'll have everything that we discussed on that website. And I know it's going to be a lot of information up there, but you feel free to please give Joy, myself a call. But first call Cammie and Lynn. We're going to throw it to them because we are here to in great support of them to do exactly what we're needing to do for our rural hospitals. And they're the experts. We're not, we're just the funders right now. And we just want to make sure that we can topple and do this 3. So we want to test it as a pilot to make sure it works. And if it does, I know it is going to work. That's not an if. When it does work, we can put it back out there to open it up to more. That's what we have to take before the board. The board is asking for a pilot first, and then once it takes off in 2 years and we're showing the data that it actually works, we can put it out there for more rural hospitals.
Thanks, Tanisha.
You guys are too quiet though.
Yeah, it's Friday. You're too quiet. We really appreciate it though. We appreciate your time, and again, we look forward to working with you. And so, yeah, happy Friday, everybody.
All
Yeah.
right. Thank you guys. And just so you know, the Zoom will be, if you need the Zoom, we'll put that on the website as well. We'll get that from Carter to put it on there. So if you have to scroll back through the Zoom to say, what did Lynn say? What did Cammie say? What did Joy say? It'll be on there. Thank you guys again for all your hard work.
Yeah, and thanks Carter for managing all the tech and
Yes.
being such good support.
Yes, Carter didn't get to introduce himself, but he is the Director of Operations for CWC. So thank you, Carter.
He's
Thank
He's
you.
the one that's been
You do
trying
it.
to, you've been trying to hurt all of us.
Poor Carter.
Oh, it's great. It's great.
Thank you guys. Give you
Thank
more time
you.
back into your day.
My riding partner's telling everybody bye too.
Oh,
Bye.
what a sweetie.
Have a good weekend, guys. Thank you.
Thank you.